Well, good afternoon, ladies and gentlemen. I've just come from our conference in Manchester, and just before I went on stage, I saw there were 3 members of North West ambulance team who were waiting in case I had a seizure in the middle of the speech to carry me away. It made me feel very safe, and then I thought, today I am surrounded by GPs. Should I feel safe? At least here, what happened in Manchester hasn't happened to me, which is that those 3 members of the ambulance team were in chemical warfare suits, which actually slightly disconcerted me before I went up to give my speech. But I have now been Health Secretary for just over a year, and I said when I was given the job that to be responsible for the NHS was the biggest privilege of my life. And I feel that more now even than I felt then. It's been an incredible year for me in a remarkable organisation. As many of you will know, I don't come from a health background at all. And so I have tried to understand the NHS by going out onto the front line most weeks, not just going and doing a royal visit, but actually mucking in, putting on the uniforms, actually taking part. I've washed emergency beds in A&E departments. I've actually manned the phones in Claire's very busy GP surgery. I've been to single-hander surgeries where the receptionists knew everyone's name as they walked through the door, which I thought was amazing. I've done a nursing round in Salford Royal, and I've learned far more from doing that than I have ever learned from sitting behind a ministerial desk. Slightly disconcertingly, the usual reaction I get from people is, "You're much nicer than we thought you'd be." But anyway, it has been something which I've learned a great deal from, and I think that has shaped my thinking in terms of the challenges that lie ahead. I've also tried to spend a lot of time with patients, and every day I try to see some of the letters that come in from patients about things that have gone wrong, and indeed try to meet some of those patients. And some of the stories inevitably are quite harrowing. Last week I met a family who'd lost their 3-year-old son in Torbay, and they were told it was unavoidable. And in fact, after a few months, they realized that there had been some mistakes. And they described how the whole system closed up, and it was just impossible to get anyone to acknowledge that something had gone wrong, except, incidentally, their GP. They said their GP was the only person who had apologized. And interestingly, they said they still use that GP, even though it's emotionally difficult for them, but they really respected that honesty. And some people in the press have described me as patient's champion. I do think it's right to speak out when there are things that are wrong. But I want to say to you that I consider myself also to be a doctor's champion, a nurse's champion, and a patient's champion. I don't think there's any contradiction in that, because I've never met a doctor or a nurse who doesn't want to champion the needs of patients. And I think it's really important that I say that to you. And I think I also have to say that I recognize that you have seen politicians come and go, and you will judge us by our actions more than our words. Bill Clinton said that politics is like working in a graveyard. There are lots of people underneath you, but they're not necessarily listening. There are 1.3 million people in the NHS family in England. But I want to say something which may surprise you, which is that I want and I hope that history will judge me to be one of the most pro-GP health secretaries in a generation. And the reason I say that is I'm a passionate supporter of the NHS and what it stands for, but I am a totally passionate supporter of general practice. And it's not just because I think we're incredibly lucky to have a system where people can have an expert who lives in their community, who can be a guide to a huge and complex system. And I think that's really deeply ingrained in our culture, and a wonderful thing that it is. But I think that your role is absolutely fundamental if we are going to make the NHS sustainable in the coming years. When I meet the health secretaries of other countries, they all say to me that everyone basically faces challenges, and the two challenges that come up time and time again that everyone is trying to grapple with is the challenge of the aging population and the challenge of financial sustainability. And if you look at those challenges, actually it comes back to general practice. You are the most cost-effective way of keeping costs down in a healthcare system, and with an aging population, you are the people who are best equipped to look after people at home rather than them having to go to hospital the whole time. We mustn't forget how serious this challenge is. And in the daily hubbub of the media, we forget the fact, as Professor Tom Kirkwood of the Newcastle University Institute of Aging said, because our life expectancy goes up by a couple of years every decade. He describes it as the 29-hour day. So for every 24 hours that you live, you're clocking on another 5 hours at the end of your life. And that is a huge opportunity, but it's also, as everyone in this room knows far better than I do, it's also a huge challenge because of the issue of comorbidities, the complex needs, the fact that we'll very soon have 3 million people in this country with not one long-term condition, not two long-term conditions, but 3 long-term conditions. That presents a huge challenge. And the view that I've come to, which I suspect you've had for a very long time, is that the NHS simply won't be sustainable unless we have a radical, fundamental transformation of out-of-hospital care. And for too long, the focus has been on the care we give in hospitals, and we haven't given enough thoughts to how we could really transform things out of hospitals. And let me say this, as a member of the public, I would like GPs to be at the heart of that transformation, because I think you can do a huge amount to make that possible. So, where do we go from here? I think we have to start with a bit of humility. Ronald Reagan said that the 9 most frightening words in the English language are, "I'm from the government and I'm here to help." And I think that might be something one or two of you have felt from time to time. I start with some principles. I think the principles that really matter, and this is first of all a very important point, that prevention is better than cure. And we need, if we're going to make the NHS sustainable in the face of this huge challenge, the demographic time bomb, we need to always be thinking about prevention, and we need to stop talking about it and actually do something to really transform the way we deal with prevention. And I think we're lucky with a national health service that we have the opportunity to do that, because we can bring together players in a way that means you can have conversations that simply wouldn't happen in other countries. I think the second thing that is really important principle is clinical leadership. We have some extraordinary things going on in our newly formed CCGs at the moment, which are happening because decisions are being taken by doctors and not by managers. And I think that's really encouraging. And I think it's also true that we politicians have to understand that the public, if there's a need for service reconfigurations or big changes, we are not very good at persuading the public of the need for those changes. Doctors are far more effective at doing it. And so I think we need to recognise the importance of clinical leadership in all those changes. The third principle that I think is very important in this is accountability. I worry that the structure that we have at the moment makes it very difficult to understand. If you've got an elderly father or grandparent who's not in hospital but has got complex long-term conditions, it's sometimes very hard to know where the buck stops in the NHS, who is actually responsible. I've seen some fantastic multidisciplinary teams, and the principle of multidisciplinary teams is really important, but sometimes I'm not quite sure who's the final decision maker. Now, as I say, as a member of the public, I'd like that to be the GP. I think that is what GPs should be. But I think that accountability is really important. And the lights are bright here. And I think that's Steve. Is that Steve Field in the front row? So Steve, I'd like to congratulate him on taking up his incredibly important new role as Chief Inspector of General Practice. And I think Steve will help make sure that we have that proper accountability in the system. And the final principle that I think is really important is that we stay true to the founding principles of the NHS. And that principle that has made the NHS the fairest country in the world when it comes to healthcare, the fairest healthcare system. We were the first country to pioneer universal coverage in 1948. It took America until 2010 to decide that they wanted to do the same thing. Well, when the NHS was founded in 1948, the big concern people had was that working men coming back from the front who'd risked their lives for our freedom should be entitled to have a life where they didn't have to worry about being able to afford decent quality health care. Now we have a different challenge, which is to make sure that as people get older, some of those same people get older, again, they're not going to have to worry about being able to receive good health care. And it's that same principle of equity that I think is really important and needs to run through all our thinking. So, what are the changes? Well, I think there are three. And I want these changes to start next year, but I recognise they won't be completed next year. But I think the three things that need to start happening, seriously start happening next year, are as follows. First, we need to really decisively move to proactive primary care, to freeing up GPs. I think that GPs want to do this. Every GP I've spoken to talks about wanting to do it. I think we've made it incredibly difficult for them to give proactive care because they're so incredibly busy and they are micromanaged to death through QOF and LES and DES and a myriad of targets, some of which don't have, well, you tell me don't have great clinical value. And in fact, I was looking through QOF on the train coming up here, and there are some targets there. I just think it looks to me like there is a system there which deprofessionalizes general practice because it removes the scope for professional discretion because every single little action you do every single day is dictated by the need to generate income for your practices, which means that you have to follow a very, very prescribed list of jobs to do. And I would like you to have more space, so proactive primary care. Now, I have to say that I think this happens in a number of GP surgeries anyway, but I think that is a very fundamental and important shift. At the same time as that, it isn't just what happens in general practice. We also need to integrate the health and social care systems. So we stop this business of people being pushed from pillar to post by one part of the system not wanting to accept someone from hospital because they don't want to take responsibility for their budget, by a nurse telling me that to get someone accepted in the social care system, it was a 32-page form she had to fill out, and if there was one spelling mistake on page 5, the form was sent back and she had to start again. But it's even worse inside the NHS because for continuing care, it was a 64-page form that had to be filled out. And I think we've got to break down those silos and barriers. And the way that we want to do that is what the Chancellor announced in July, which is allocate a big chunk of the NHS budget, £3.8 billion, that will be so big that local authorities do not want to ignore it, but in order to access that money, they will have to jointly commission with CCGs. There'll have to be full data sharing. There'll have to be 7-day opening of the social care system so people can be discharged at weekends. A whole range of things that I hope will force these two bits of the system to really work together in a way that hasn't happened before. And although the budget doesn't start till April 2015, because it was decided as part of that spending round, we've actually asked for those plans to be completed and approved by April 2014. And the reason for that is because there's so much enthusiasm that a lot of places don't want to wait until 2015 to start. They want to start right away. And many of you, I think, will be involved in those discussions through your CCGs. And I want to thank you for the work you're doing to make that possible. The third pillar, which I think is essential to make this happen, is to really crack the whole business of data sharing. And here we owe a massive debt to general practice, because you sort of stayed out of the various problems that we've had with the NHS IT systems. In fact, you rebelled, and System 1 and EMIS hung on in there, and they were the bad boys who carried on. And the truth is that as a result of that, we actually have the basis for an electronic health record in the NHS, thanks to general practice, that I think can be the heart of an electronic record that can travel throughout the system. And I want to thank the RCGP, because you've been very constructive in helping us work out the protocols which will allow those records to be shared. I think the basic principle has to be that it's shared with the consent of patients. But I think we can crack this, but that is something which I've been also focusing a lot of attention on. So what happens next year, and more specifically what happens in the next few months? Well, I think the things we need to look at is, first of all, the reform of QOF. I think every single QOF target has a good purpose behind it, but I think some of them are less clinically effective than others, and I think we have to ask whether, taken as a package, this is something that actually allows us to get the most out of GPs and to tap into their own professional judgment. So I think that's very important. The second thing we need to do is to make sure that we really can have proactive care. And I think the way we do that is not by trying to do it for everyone all at once, but by focusing on the frail elderly for next year. I think this is such a big change, the transformation of out-of-hospital care, that we should think about it in terms of the key population groups. And I'd like us to sort out what we're going to do for the frail elderly next year, starting from April, then move on to everyone with long-term conditions from the following April 2015, and then think about children and young mothers, and then the normally healthy, and those are both very big agendas as well, but I think we should do it step by step. We also need to look at whether we give you as practices the autonomy you need to actually be accountable clinicians for people outside hospitals. I'm interested in exploring whether you can be given more responsibility for allocating district nursing hours for the people on your lists. For people who want to, and this won't be everyone, whether you could take more responsibility for the out-of-hours service in your areas. I think those are things which, if you're going to give that wraparound service, you'll want to be responsible for, even if you're not actually delivering those services personally yourself. And so those are things that we all need to look at. Now, these are really big challenges. It's going to be difficult for you, and it's going to be difficult for me, but I think it's the right thing for patients that we should try to address them. And I think we should, in this 65th year of the NHS, approach this with a spirit of optimism. I mean, that founding vision of the NHS was very, very ambitious. And I think we should be ambitious too. And the way that I would like to characterize this is that I think our aim should be to make Britain the best country in the world to grow old in. And I think it will do that if we reinvigorate and back general practice at its very core, because I think that's what it's all about. Thank you very much.